Good afternoon. This is Sherry DeBali with Redoubt News. We're here in Rathdrum. They've got a protest going on behalf of a woman that was cited for having a yard sale. One of the people here at the protest is Kim Keller Hall. And say hello, Kim.
Hello.
Tell everybody why I snagged you over here to talk to us.
Oh, okay. Well, for 18 years, my career was to code medical records, which would be using alphanumeric codes developed by the World Health Organization and used by the CDC for reporting, for research, and for reimbursement. And I had 2 national credentials that I held. I went all across the country doing this from New Hampshire, Virginia, Oklahoma, California, Oregon, all the way up to Seattle, then over here to Coeur d'Alene. I would assign the principal diagnoses and all complications and comorbidities. I have a degree in health information management, and I knew something wasn't right about all of this COVID information and scare when they started assigning the death certificates making the cause of death COVID or possible COVID. And it's like, that goes against all the rules and regulations that the CDC and the WHO have implemented over, decades. That you don't just assign something like that if that's not the cause of death. So what that said to me was that the numbers that they're collecting to report are going to be skewed, and they're skewing them to their, is it a political scheme they're doing? I that's the part that's really hard to grasp. But President Trump, does he understand what all this means? And where are all the honest doctors? Well, you aren't going to hear them on the MSM because they're not going to interview them. All the doctors who know better, all the doctors who are scratching their heads and are scared too, because they know that they're skewing the numbers to make their, whoever they are, the WHO, the CDC,
We have shared the pages from the CDC, as well as several other people, that state right on there that everybody is directed to change the listing on the death certificates to reflect COVID, regardless of whether or not a person has been tested, regardless of whether or not they know for sure the person was ever infected. Now, like you say, this sounds almost political. Could there be another reason they would do this? Can you think of any other reason anybody might do this? Because, I've talked to a lot of health professionals, and not one of them can give me a reasonable response to that.
Yeah, I don't understand either. That's the part that makes me very suspicious and makes me very angry, for one, because those diagnoses that are put on there, or those codes that are put on there, are sent to each state health department, sent to the CDC and to the WHO, and that's where they get their information for to finance, to send monies to hospitals, to send monies to states, to the health departments. So,
what do you think about President Trump's announcements to investigate the World Health Organization?
Oh, it's about time. I can't believe the billions of dollars they've spent on supposedly researching, when a virus jumps from animal to human. How often does that happen? And they're in there creating viruses to jump from animal to human so they can come up with a vaccination or a cure. That's just too fishy. It's not a reasonable. It's not reasonable to be spending our money on that.
Are you looking forward to a vaccine for this?
Oh, heck no. No, there's no way. I've coded so many records of little children that have adverse reactions to vaccines. And then even with a VAERS report, the doctors refuse to fill out a VAERS report.
What is a VAERS report?
It's a vaccination accident exception. I can't remember, but it's when a adverse effect happens after a vaccination. And it doesn't even have to be one that's a common one. They're supposed to report any adverse effects after a vaccination, and they refuse to do it. And so that information that's supposed to go to the CDC is skewed because the doctors themselves refuse to fill out the forms. And even the nurses can fill them out. Even the patient's parents can fill it out. So, you know.
That seems to be part of the new normal now, doesn't it?
Oh yeah, that's the new normal.
That is the new normal. It is something that we need to worry about. And everybody needs to do their own research and do their own investigation. But call the people who know to help guide you where to look.
Right. And then in vaccinations, most people are now beginning to find out there's aborted baby cells, fetal cells, in these vaccinations that they've developed. And I'm sorry, but I don't want a baby aborted just specifically to come up with a vaccination to help somebody not have the measles, the mumps, the chicken pox, or the flu. That's barbaric, and that's not who we should be.
No, it's not a Christian way of
No,
looking at things.
it's not. That's Dr. Mengele.
Yeah.
It's Dr. Mengele.
Thank you, Kim, for
Oh,
joining
you're
us today.
You're welcome. Thank you for being here.
Appreciate you being out here for this rally. We all need to jump up and start supporting our neighbors that are fighting this overreach. Thank you.
Thanks.